Hello, friends. I hope you are having a lovely week so far. My name is Dr. Emlah and your host of the Intentional Living Podcast with Emlah. Today, I have the honor of having my friend, Dr. Pragna Dadania, again on the show. Reason being that after the first episode aired with her, the number of emails, calls, and visits to the pharmacy that I had asking me to bring her back was enormous. And it really made me happy because a lot of times you start something like this and you wonder, are people actually listening? Are they gaining something from it? But the feedback that I had when I had you on the show the first time solidified the reason and made me just know that we're doing something great and sharing the information that, as you go through medical school, you do your specialty and residency and all that knowledge is in your head. But we as your patients, we as your friends, we need to benefit from that. So the more time we spend listening to you, the better for our health. Thank you for coming again.
Yes, thank you for having me again.
I'm so honored. So Dr. Dadania is board certified OBGYN and also a Menopause Society certified practitioner.
Yes.
And I'll tell you another certification that she has that prompted the discussion for today. But we're honored to have you.
Thank you.
Thank you. And so before we start, I would always like to ask, I want to know, what does intentional living mean to you this time around again?
Yes. So I don't exactly know what I said last time.
Let's hear the new one.
So what I'm currently thinking about with intentional living is that it is really me really choosing how I spend my time, my energy, and attention.
I love that.
Instead of letting life choose for me, instead of living and going through life on autopilot, but really thinking about my intentions, my decisions, making sure that it aligns with my values, and also making sure that I'm gaining something from it, especially something positive, and it's helping me grow in some way.
Helping you grow, like choosing, it's again brings that from switching from autopilot to aligned, and your time, your energy, and your values. That's what I heard from that.
Yeah.
That sounds so powerful. Thank you very much for that. It's a beautiful reminder for us. Again, about spending time. I love spending time with you as a pharmacist and as your friend and as your patient. So in all three facets, I gain something from you every time we talk. The last time we were talking and you talked about Ishwish, and I was like, what is that?
Yes.
So just tell our audience today what Ishwish is.
Yeah. So Ishwish, it's an acronym.
Yes.
It stands for the International Society for the Study of Women's Sexual Health. So that's a mouthful. So that's why we refer to it as Ishwish. But really, they are sort of, the gurus, the society for guidelines when it comes to the study of women's sexual health. And yes, I am a member of this wonderful organization because really it provides the level of education that I need to help my patients, the women in midlife.
You know what I just thought about? I need to preface this with what we're going to be talking about today. This is going to be a purely adult conversation. So I just need to preface our listeners with, we're going to be talking about sexual health today. And that's the reason why I brought up the Ishwish, because when you brought it, I was like, what a perfect topic.
Yes.
Because we don't talk about it enough because it's taboo. And a part of me was like, do we want to talk about sexual health on an intentional living podcast? But I'm like, Emlah, why not? This is our life and we need to talk about all the things. We don't want to fit into the stereotype of not talking about the things that affect all of us.
That's true.
So that's why we have you on today and we're excited to learn from you. So back to Ishwish. When you were talking, I was just like, Emlah, preface this. So sometimes I listen to this stuff with my children in the car and everything. So I was like, today we're talking about Ishwish. Remind me what it is.
Yes. So Ishwish is an acronym and it stands for the International Society for the Study of Women's Sexual Health. So big international organization whose focus is sexual medicine, sexual health and wellness. And really, they are sort of our governing society. They come out with new guidelines for different things. And so they have lots of good education for providers and practitioners. So I often am on their site helping myself so I can help the women that I see. And they also have resources for patients too. So they really have some good information, similarly to the Menopause Society, where they have information about menopause. Ishwish is very much geared towards sexual health.
All right, perfect. We will have a link to the website on the show notes as well. But I would love to ask you, what are some of the changes that you see? And so when you say sexual dysfunction? What do you typically mean by that?
So, first I just want to preface and say, changes in sexual function for women in midlife, it's pretty common. So up to 70% of women will report a change or notice something different. So 70%, that's a lot of people.
That's a lot.
And it is a subject that I think I agree doesn't get a lot of airtime. We don't talk about it.
We don't talk about it. Yeah.
And I think even as women, we kind of have to be selective of who we can share and open up to because, not every friend in our life is somebody that we can talk to about this. And so it is extremely, pretty common.
70%.
70% of women report some sort of change.
Yeah, a lot of things happen. And, you come to talking to providers about things like this is like things like which are uncomfortable subjects like diarrhea, constipation, GI health, sexual health. It's hard, but I'm glad that we have people like you who are open to discussing things like this with our patients. What are some of the changes that women notice, during this period?
So, in taking a step back to perimenopause and menopause, our hormones do play a large part in our sexual health. And because our hormones are fluctuating, changing, eventually decreasing, we see these factors play out with our body. So with, estrogen changes, estrogen decline, we see changes to the vagina. So the vagina becomes drier, becomes less elastic,
which
meaning
is common. You
less
hear the complaints
stretch.
all the time. Yeah.
You're more prone to bladder symptoms. So if you have any of that going on, it is definitely going to make sex uncomfortable. We have, progesterone. Progesterone plays a role in, sleep, energy, mood. And so obviously if we're not at our best, we're not sleeping well, our mood's low, our energy's low, then our sexual health and wellness is really going to go to the bottom of our priority list. And then we have testosterone. So our ovaries produce testosterone. It peaks in our 20s and then it steadily declines and it continues to decline. And so, what we see with testosterone is that we see testosterone play a role in desire. So now you have all three hormones fluctuating, declining, and creating all this havoc in our body. So it's only natural, so to speak, that we are going to see changes in our sexual health and things are not going to be the same as they were in our 20s and 30s, as they are in our 40s, 50s, and beyond.
I see that. I love that you preface that with progesterone. Do you have a favorite hormone of all of them?
I don't know if I do, but I think
you're not gonna pick sides. I noticed that you preface with progesterone, and I know that you prescribe it quite a bit. A lot of your patients, when they come to the pharmacy with a prescription from you, it's usually progesterone as well for sleep. So tell us how progesterone helps with sleep.
So progesterone helps with sleep in that it releases GABA, which GABA neurotransmitter. And that's what really helps kind of relax us. And it can help with that falling asleep, staying asleep. Now, not all women will have that effect with progesterone. The way we all react to different hormones, different medications varies. But, in theory, I would say up to a third of women will notice great, sleep improvement with the addition of progesterone alone.
Lovely. You notice how, when she said falling asleep and staying asleep, because when we talk about sleep, prefacing all of this, everything that happens during the day is a reflection of how much sleep, how well rested you are. Restorative sleep it is. So because when falling asleep, not just falling asleep, but staying asleep and getting a restful sleep so that your body is re-energized to wake up in the morning. With progesterone, again, 100 milligrams, 200 milligrams, pharmaceutically available doses. But then again, at the pharmacy, we can compound different strengths that you need for your patients. So that's the beauty again of compounding and just hormone replacement therapy, which in the last episode that we were together, you talked about the benefits of it and how it's not for everybody and how you evaluate your patients to get those. What beautiful, beautiful knowledge. So do women typically see an increase in UTIs?
So you can.
This.
You can. In perimenopause, postmenopause, definitely. And sometimes it takes a little bit to connect the dots. But, what happens, we see changes in the vagina. So, the vaginal pH actually changes from an acidic environment to one that's a little bit more basic. So that allows us to be more prone to infections. The urethra, or, the hole where our urine comes out, gets smaller. Positionally, it changes. And so all this is kind of a setup to an increase in urinary tract infections. So sometimes I will see women and they'll say, oh my gosh, all of a sudden I had like 3 urinary tract infections last year and I haven't ever had them, or I didn't have one, since I was 20. And so that's usually an indicator that,
Yes.
Changes are happening to the vaginal area, the bladder, the vulva, which is the outside of the vagina. And so sometimes it takes, seeing your OBGYN or maybe a menopause specialist to say, hey, we don't need to be treating every single urinary tract infection, but taking a more proactive approach. And vaginal estrogen is a very safe, easy, affordable option that probably all women in menopause may eventually need and should be taking.
This podcast is sponsored by Journeys, your path to intentional wellness. Most health problems don't start overnight, and neither does wellness. With Journeys, you can take charge of your health before you have to. Every cell in your body is speaking to you. But when we ignore preventive medicine, we wait until those cells are screaming. Journeys helps you listen to the whispers. There are 3 different journeys to choose from, each designed to meet you where you are in your wellness path. The Core Wellness Journey for $199 offers a foundational look at your overall health, perfect for getting started and measuring 66 biomarkers. The Advanced Heart and Metabolic Health Journey for $339 measures 111 biomarkers and goes deeper into cardiovascular, metabolic, and thyroid health for a more detailed picture. The Comprehensive Longevity and Hormone Journey costs $469 and is the most complete view, including hormone, nutrient markers that support energy, balance, and healthy aging. This measures 120 biomarkers. Each journey includes a personalized recommendation, one-on-one care from your pharmacist, and follow-up support to help you turn results into lasting intentional change. You just won't get data. You'll get guidance, accountability, and a partner in your wellness journey. Intentional living means paying attention, staying curious, and taking steps towards the health you deserve. Start your journeys today. Click the link in the show notes. I love that. I love that you bring so many more options to the table, because when we think of urinary tract infections, we always think of phenazopyridine, we think of Bactrim, we think of Cipro, we think of, our antibiotics. And then when you take the antibiotic and then you're expecting maybe some fungal infections to follow that. And then we follow up with a fluconazole, and then we're just messing with the pH.
Yes.
And the vaginal pH is just messed up. And like you said, it's a setup for continuous urinary tract infections. So I love that you're bringing more options to the table with hormonal, with topical hormonal therapy.
And the other instances that I see too are women will complain of urinary symptoms such as burning, maybe frequency, urgency, and they may or may not get tested for a urinary tract infection, or that's what they think they have. So they may just get a prescription for an antibiotic, or they may get their urine tested and then come to find out they actually don't have a urinary tract infection. And so those are also signs of changes due to menopause. And, we have a fancy term. It's called genitourinary syndrome of menopause, or GSM. And so you can have these bladder symptoms that you think are a urinary tract infection, but they're not. And maybe you do take the antibiotics and you don't get better.
Yeah.
And that, again, is a role for vaginal estrogen and kind of restoring the pH, the moisture, the elasticity, and improving bladder health, because our bladder also has estrogen receptors.
Yes.
I mean, we have estrogen receptors head to toe. The bladder and vagina, they have them as well.
I just love talking with you. You just bring so many facets to the table. And again, a link to seeing you will be in the show notes so that our patients can have the benefit of getting all this knowledge. Tell me, what is the difference between low libido and GSM?
Yeah. So GSM, or the genitourinary syndrome of menopause, sort of refers to the constellation signs and symptoms that we see that affect the vulva. So again, the outside of the vagina. So things like maybe dryness, sensitivity, irritation. There may just be like a spot on the outside that bothers you. When we talk about the vagina, it's dryness. It's the lack of elasticity. It's that, we're not seeing that stretch as we used to. And then the bladder. So it changes with the bladder, like I mentioned. So burning, frequency, urgency, maybe a little increase in incontinence. And so these are the constellation of symptoms and signs that we can see that happen to the bladder, vagina, and the vulva. can start in perimenopause. So it can start when you're still having your periods.
Yeah.
And then, it is something that is progressive. So it
Yes.
can get worse with time. So, as we lose these hormones, these changes can become more profound. The nice thing about this is that we do have great options to help manage this, vaginal estrogen being the gold standard.
Yes.
Really, it is really safe for anybody to take. So I'm talking about women with breast cancer, women who've had strokes. There's no age limit. Really some of the menopause experts even advocate that this should be available over the counter because there's really nobody that can't take it. I would say the only situation would be, if you're somebody who all of a sudden has vaginal bleeding and we don't have a good reason for it, meaning undiagnosed vaginal bleeding. That really should be, requires an evaluation before we're adding vaginal estrogen. But so that's how we would define the genitourinary syndrome of menopause, or GSM. We used to call it vaginal atrophy. So that was the old term. It's now been rebranded to GSM. Yes. So it was rebranded because,
vaginal atrophy sounds bad.
Yeah. We didn't want to, use the word GSM. Atrophy.
Yeah.
Yes. Now, the second part of the question, so low libido, so libido kind of referring to your sex drive.
Yes.
So a very common complaint that we see in women in midlife is, just that your sex drive decreasing. And there is a multitude of factors that play a role in this. And probably for most women, it's probably a combination of things, as is with life. It's hard to kind of pinpoint it to one thing or another, but there's probably a lot of things. So that has to do more with the desire, the thought of wanting to be sexually active and intimate.
So with this, I'm thinking of the number of options that we have, because prior to now, women are thinking, oh, this is just something that I'm going to have to deal with. These are just the changes that come with perimenopause. These are the changes that come as menopause is coming, and I'm just going to have to deal with it. But therapeutically and pharmacologically, there are lots of options that you have, when patients come to see you. Recently, you prescribed Scream Cream.
Yes.
For our patients, and I always, I thought the name was interesting. And so we do think the name is interesting. But tell us more. What is in Scream Cream? It is a cream that we compound at the pharmacy when you prescribe it. So, and we see a lot of other providers prescribing it. So tell us more about the Scream Cream. Yeah.
So Scream Cream, it really helps with arousal and orgasm. And so, again, changes in sexual health.
Yes.
We do notice decreased arousal, maybe decreased in the number of orgasms, the intensity of orgasms for women. So we can get, currently the only way to get this Scream Cream, it is compounded. The main ingredient that we see is sildenafil, which is the main ingredient of Viagra, so what we see for men. And what it really does is it helps increase blood flow to the vulva and the vagina. And so it does require some planning. So the thought is that, you would apply some to the vulvovaginal area, maybe about 15 to 30 minutes before anticipated sexual activity. And it's really there to help increase blood flow, increase arousal, and hopefully increase orgasm and sexual function for women. So just something,
Another
new
option,
and exciting
to
try. If this is an area where you feel like you are struggling with, again, we have options. This is topical. It's as needed. So pretty safe.
Thank you. We talked about the hormonal changes, and you said it's a constellation of hormonal changes, that leads us through this part, as is perimenopause. And you talked about some therapeutic options that you have. What about some non-pharmacologic options that we can, as women, we can use to help us with the low libido and the GSM symptoms?
Yes.
Yes.
So I would say, so non-pharmacologic options, I always go back to sleep. Like sleep.
Yes,
sleep
we started
is key,
there and we're coming back there.
Because honestly, having the right amount of sleep, the deep sleep, the restorative sleep is really going to set us up for success each day. And so if we're tired, if our energy is low, if our mood is low, then honestly, we're not going to be...
Everything else is going to be low.
Right.
Yes.
And so that's, I think number one, sleep is important. So not just for sexual health, but many aspects of our health, our heart, our bone, our heart, our brains, mood, metabolism. And so really... that's why I like talking about sleep.
You just keep going on and on. I'm like, should we have another episode on the benefits of sleep?
And maybe
we should.
Yeah.
Yeah. Maybe we should.
And the sleep expert, which I am not,
but you, every time I'm talking with about women's health with you, you always start with sleep. Somewhere in the middle there's sleep, somewhere at the end of it is sleep.
Yeah.
Because the other thing is that as with women, as we see a lot of women, a lot of times we don't prioritize sleep.
We don't.
At the back of our mind, sleep is, a waste of our time, and we just do it when we absolutely have to, when we've taken care of everybody else and everything else at home, and then we just pass out and are stressed and tired and fall asleep stressed and tired and wake up stressed and tired.
Yes.
So no restful sleep,
yes.
So always, when people come in complaining of sleep, I always go to magnesium. Magnesium is usually one of my go-tos. Magnesium glycinate, magnesium threonate, and melatonin is not a go-to for me when it comes to sleep.
Same.
Yeah, because of high doses of melatonin, I always remind my patients, can cause nightmares. And again, we've had people who have been using Benadryl, Unisom for a very long time. I had a patient who came in and she said, change my supplements, change all my things, but don't take away my sleep aid. And you know what was in her sleep aid? Unisom. It was Benadryl and it was doxylamine. Yes. And these are the first generation antihistamines that have now been proven to increase risk of early onset dementia.
Yes.
So we want to be able to help our sleep with things like, maybe an herbal tea at bedtime, a good sleep hygiene.
Yes.
No phones.
Right.
An hour before bedtime, winding down, taking a bath, an Epsom salt bath, lavender oil, a book.
Meditation.
Journaling. Yes, please.
Yes.
Journaling.
Yes.
Thank you.
Yes. I think we underestimate the power of good sleep hygiene.
Yeah. And the good sleep hygiene kind of relaxes you, reduces stress levels, reduces cortisol levels, increases melatonin production, and just puts you in the mood to rest your body. And that itself can increase libido and also reduce the symptoms of JSM. Am I right on that?
Yes.
Thank you.
Yes.
So I just don't even know how much we can emphasize the importance of good sleep.
Yes.
Yeah. As women, we suck it up a lot. We just, this is part of life. Emlah, just be brave, just move on with it. And it's okay. It's going to be okay. It'll be better tomorrow if I just work a little harder. If I just persevere. We're kind of born with that aspect in us. So when is it time as a woman to see a menopause expert? Like when is it time? Because we postpone it a lot.
Yes. Because we honestly do take care of ourselves last, even though we should take care of ourselves first.
I know.
I'm guilty of this as well.
Yes. Tell us, when is it time to, stop, see a menopause expert? It's time to schedule your appointment.
Yes.
Yeah.
So, if you're experiencing any of these signs or symptoms of perimenopause, menopause, changes in sexual health, if you're having any of these symptoms and you're being bothered by it, it's affecting your day-to-day, it's affecting your relationships, maybe it's affecting your job, then it's definitely time to see someone, because there are lots of choices. We have simple lifestyle things that maybe we didn't think about. We have non-hormonal options. We have hormonal options. So there is a lot out there, and we don't need to struggle. And it's very common. And so I think sometimes we feel alone, that we might be the only ones going through this, but we're not.
You're not that special.
Yeah.
If you're listening to the show right now, Dr. Patel just said, you are not that special. You're not the only one going through those symptoms. Yes. All of us are. So it is time to really be the driver of your health.
Right.
Yes.
And I think if you're not getting answers from whoever is on your healthcare team right now, be it it's your primary care physician, maybe it's your OBGYN, don't be afraid to bring up these topics. And in the same regard, we have to realize that a lot of these concerns, it's not something that we can adequately address and fix in like a single 10 to 15 minute visit that you may have with your provider once a year or once every 6 months. We need to give it its due diligence. So it a lot of times, I tell women, it is a journey, and I will be there with you every step of the way. So we're not going to be able to fix, low libido in a 15-minute visit. So we probably need to do trial and error, see what works for you, make it very individualized, and something where we are, connecting every so often. Yes. So this may require multiple longer visits
Yes.
to achieve your goals.
Desired
And I
goal.
think that's where, we kind of need to see a shift in our healthcare system. Like a
Yes.
15-minute visit isn't going to cut it when
No,
we also have
no.
to talk about, immunizations and cancer screenings and your heart health. There's so many things. And so, definitely women advocate for yourselves, speak up. And, your primary care physician, your OBGYN may be wonderful, but if sexual health isn't one of their top passionate interests that they're an expert on, then yes, definitely seek out, a menopause expert.
Seek out a menopause expert like Dr. Dadania. She mentioned that she said this is not a one-time fix. This is a journey. And when she said that word journey, you know what came to my mind. Our journeys, which is your first step towards preventive medicine. And talking about our journeys is a testing platform, which we have 3 levels of entries, and we test over 100. We test 120 different biomarkers. We're testing all your hormones, cortisol, testosterone, DHEA, progesterone, estrogen. We're testing all these hormones, including nutrient biomarkers like vitamin D, magnesium levels, inflammation levels, like your C-reactive protein, high sensitivity C-reactive protein, ApoB for cardiovascular health. So it's when you have these markers and we sit down with you at the pharmacy to be able to tell you what supplements you should be taking, what lifestyle changes you can make, and what physician you can see. Usually at the end of journeys, we usually refer our patients to see Dr. Dadania to adjust their hormone levels and see what other options she can do to just help them lead a fulfilled life and just have them as they embark on this journey of leading an intentional life, which really nobody wants to suffer. Nobody wants to be in bad health. So thank you for being a great partner.
Yeah.
And thank you for taking care of our patients, our friends, and our community. I'm honored to have you on this podcast.
Oh, thank you. I'm so glad you invited me back. It was a lot of fun the first time around and fun again second time around. And
well, we will have you again.
Okay.
Because this is selfish because I benefit from this. I learn something every time I talk with you.
Wow.
So I learned something and I just imagine that my audience also learns something every time they talk with you. So if you have learned something, please share this podcast with any woman in your life who you think will benefit from this. We don't talk about this enough, but I just wanted to bring this out and to the limelight because Dr. Dadania and I had a beautiful conversation about this. And I said, you know what, let's bring this to the podcast. And I hope that this inspires you to take a step in your health and share this podcast with people around you who will benefit from this. Thank you very much and have a lovely week.